Tara, I think that's your screen. Do you mind hitting got it?
I am, and it's just in that circle of.
I see that.
Oh, there we go.
Okay. All right. Welcome everyone to the August Learning Forum for KPQC. I'm still admitting everyone from the waiting room, so I'll continue to do that. Nice to see all of you. Welcome back. It seems like we haven't seen each other forever. And I am going to just hand it over to Tara to go ahead and get us started, and I'll keep admitting people. So welcome.
Hi, everybody. Welcome back. So we took a break in July from our KPQC learning forums to really just dig deep into the work that was constantly in motion, and to give you a summer break, perhaps, from these really helpful and eventful webinars we've done. We have a lot of great content today, so I'm just going to touch on some of our rapid response moments. I think this is a helpful way for us to start out our time together so that you have perhaps just a few of the highlights or FYIs that are occurring throughout the state. Again, my name is Tara Stroda. If there's some new folks that are on the call today, I am the maternal QI coordinator for the Kansas Perinatal Quality Collaborative. There are several of us that are on the team, the leadership team for this this initiative we call the first trimester. That is the current project that the Kansas Perinatal Quality Collaborative has chosen to deep dive in. We're going to hear from another lead and certainly a champion within one of the most important pieces of our initiative today as our keynote speaker. But again, welcome. We're thrilled you're here. If you could in the chat put your name and what agency that you are attached to or affiliated with, that would be great. We do take attendance to show what numbers and agencies are represented, certainly as a way to reach out for contact afterwards as well. Again, highlights of the last couple of months since we last saw each other, actually, which was in June. The Kansas Perinatal Quality Collaborative, including myself and Casey, lots of folks from Kansas Department of Health and Environment, and some specific entities within the Kansas Perinatal Quality Community Collaborative have all been doing site visits throughout Kansas. What do all those initials mean? What they mean is that we are trying to work harder to connect the inpatient fourth trimester sites to the outpatient public health sectors, and quite frankly, anybody in those communities that is helpful and attached to maternal health improvement. And so through these site visits, like you see pictured there, we are excited to hear about the immediate postpartum side on the hospital and birth center side, and how they're beginning to refer patients to multiple connections within their communities, and how the communities are reaching out to the hospitals to streamline actually pregnancy into delivery and delivery into postpartum care. This is the connection that we need to make standardized. And who you see pictured there is a broad referral network represented, and all met at Advent Health Shining Mission last week. Great conversation about how Wyandotte County and Johnson County Health Departments are open arms and encouraging more and more communication to the inpatient setting. Also using community health workers, CHWs, throughout the state to make those connections more robust. And to navigate patients to the inpatient and outpatient setting. And it was a wonderful group of brainstorming that day. Our local hospital participated today. I think Newman is participating this afternoon. So if we haven't reached out, or the KDHE team hasn't reached out for a site visit, trust me when we say we will. But again, congratulations to all those who are doing all the great work across Kansas. This is the KCC update, and Patricia or Jennifer, you got there's Jennifer. You want to jump on and give your update for me?
Sure. Thanks, Tara. Good to see everyone today. So we are expanding our cohort coming up on the 5th grant year of KCC, and we are expanding our cohort to include all of you lovely people. So previously, if you'll remember, we had a smaller cohort of about 9 hospitals and birthing centers that we were working with to implement maternal mental health screening. And we are going to expand that out to everyone. Everyone will have access starting in October to small group technical assistance workshops where we dive into specific pieces of screening implementation, including policy development and referral processes, patient interventions, staff training, workflows, all of the nitty-gritty details. And you'll also have access to one-on-one technical assistance with our team to work on EMR updates or inpatient to outpatient referral workflows, whatever your organization specifically needs. If that's not covered in a small group TA workshop, then we will set up a time to work with you and help you get that screening in place. As part of that, we have some limited stipends available for to support kind of changing those EMR practices to get data collection in place so that you can actually see what your data looks like and do some continuing quality improvement. So if you're interested in that, let Patricia or I know. There's the email on the slide. We're also here in the chat. So let us know and we can connect with you individually moving forward. Next slide, please. Thank you. So a couple of upcoming due dates for our team. For sites that are currently submitting screening data quarterly and you are receiving a stipend like currently, I need you to fill out a new clinic acknowledgement before the start of year 5. So this QR code you can use. You'll also get a link to complete this with your data dashboard that will go out this week. But I need you to complete this no later than Friday, September 16th, because KDHE has to have this on file to process your stipend in October. So this is really important for you to get done by that September 16th deadline. Coming up in October, we'll have the JBS annual survey. It is incentivized. It's a part of our federal grant funding, and it will be only to our current TA cohort. In November, we're going to plan another round of a needs assessment. All of the content for the workshops came out of your feedback from last year's assessment when we kind of we surveyed everyone and said, like, what do you need to work on in the coming year? And a lot of you said workflow and policy development. And so we did the workshops and some additional trainings around that. We're going to do another round to see kind of what your needs are for the upcoming year so that we can pull in experts and plan some workshop learning around that. So that's coming up in November. And I think that's all that I have. If you have questions, feel free to email us or pop them in the chat and we can address them later. Thank you, Tara.
Jennifer, thank you. And as those of you on the call who know KCC's team, easier said than not, this group of powerhouse experts in maternal mental health, all things maternal mental health, are connected literally at every level, from inpatient care, outpatient care, public health, private practice, all the way through. And if you have not connected, hear what Jennifer said. If you have not been part of the TA group, you're up, you're on deck, and you're ready. And so I'm thrilled that we get to offer all of the technical assistance to all of our sites. But I would also encourage you to hear Jennifer say, just reach out with questions. They are nonstop helpful resources. And KCC, thank you. You guys do a great job with one of the most concerning parts of our project, which is maternal mental health and adverse outcomes in Kansas. So thank you. Speaking of that, again, we like to present resources to you. I almost picture that you may have a list or a 3-ring binder or a file on your desktop with resources that you can give rapid fire to your families that you take care of. And this is from HRSA, the National Maternal Mental Health Hotline. Came through email, saw it disseminated, and wanted to make sure it was in front of you all. You know that we also have a provider hotline so that nurses, midwives, doctors, nurse practitioners, PAs can consult quickly for maternal mental health needs that they see with patients. But this is another resource specific to the pregnant and new moms that we take care of. Wonderful resources. You're seeing more and more of them nationally launched, and that will help certainly the crisis that we experience in our at the bedside. Prior to bedside, conversation that I wanted to bring up to you all just so you have a pulse on what's happening across the state. It will impact you locally. And again, this is all part of our broad project initiative, which is to connect every mom to every resource, including when it's 911. So the idea that EMS at the state level, his name's Joe House, one of our nurse champions who does a lot of work with EMS training and triage and transport of high-risk OBs in our state. Heather Scruton has called, and we talked about how to connect the 4th trimester work in the hospital to EMS training and conversation. And she got direct access to Joe House, who's the director of the Kansas Board of EMS Services. Sure enough, Joe agreed to include the simple screening question. Again, remember, this is at 911 emergency ambulance phone moments. Are you pregnant now, or have you been pregnant in the past 12 months? For those of us on the KMRC group, we know that oftentimes it's EMS, urgent care, ER, EDs that miss a moment or didn't know that she was pregnant or within the first 12 months postpartum. And that's a critical algorithm change. And so we're excited that, in fact, EMS services are going to include this in their triage questioning. That means they should come to your facility triaged. We know now that she's postpartum or pregnant. And then again, we can all begin to respond in a much more brilliant way. In another facet of how do we get more information to patients, but how do we allow them to reach out on their own to find resources that they may be searching for but don't know where to go? This is a new KDHE resource that is, again, a guide to Kansas family supports. It's an exhaustive list with QR codes, a brief about each service that KDHE provides, and it is awesome. Certainly an act of work and an act of love that they put all of these things together in one resource. Drew Duncan, that does a lot of work. You guys have heard his name before, but certainly is a state leader in pushing out resources and getting families to connect to all the services we provide, is a champion behind this. He, and his email is listed there. If you would like for KDHE to send your hospital or your agency printed copies of this, it's a trifold flyer, email him. If you'd like digital copies, I can send those to you. Drew gave me permission to do that. You certainly can ask Drew the same question. But if you want the digital copy of this front and back resource, reach out to me and I'll send it your way. Great option for new families to have, maybe even in the postpartum setting, immediate postpartum setting, but wanted you all to have that as well. And we got a brief update from KCC. I just put this here to remind myself to tell you all that it's obvious in the data that I receive from you all that you're increasing your screening for maternal mental health and your referral rate. I'm hearing that at the site visits as well. And that's a major change of continuum, because we want to make sure that every patient has every opportunity to get every help available. And you all are making that change happen. Gentle reminder of where we are in the 2022 4th trimester project. This is the timeline that I kind of set out for us when we were together in May. This is August, late August, almost September actually already, and we're finishing up that post-birth training, obviously working on Kansas Birth Equity Network training, which is the predominance of what we're going to discuss today, and working through those other policies, TA work, etc. If you're not sure where you are on these projects or what comes next, I would ask you just to reach out. I love those check-ins. I love to help you move forward or to make sure that I have a temperature check on how well you're doing and what I can do to be of assistance. But that's where we are until the end of the year. And then again, the processes in progress will continue into 2023. Quick note about data collection. We're still waiting on National AIM data center to open, so don't worry, you don't owe us anything yet. If you have questions about signing up through the QHSI system, if you're a 4th trimester hospital, have connected with Sally or Stuart already, just ask, just send those questions to me. But at this point, there's nothing that you need to submit. We will let you know as soon as we get that rolling. Now, without further ado, I'd like to introduce our colleague, and I mentioned her as a champion. She is, I would say, the leader of another group of champions who are the Kansas Birth Equity Network. I am going to tell you that what Dr. Smith and her colleagues have done to amplify the conversation of birth equity in the state of Kansas is unmatched throughout the nation. When we talk about that we're the only state that's doing this bundle, I will tell you that birth equity is mentioned in a lot of the AIM bundles as part of the process improvement, but nobody knows what that means or who to go to for training. So as Dr. Smith talks to us all today, and she talks about the process that Kansas is undergoing, you're talking to literally the state and national leader. No pressure, Dr. Smith, but take it from there.
Well, that is a hard one to follow, but I will definitely do my best. There is definitely some amazing work being done in our state, and I'm happy to be a Kansan at this time in my life. I am sharing my screen. It takes a little minute for me to make everything happen because I work from 3 screens, but I'll be with you shortly. All right. So it is just a great opportunity for me to get an opportunity to come to you during these meetings to talk about our curriculum and the work that we're doing with the Kansas Birth Equity Network, as well as work that we're doing collaboratively in our state. So again, just to remind you that our mission is really to use a community-centered approach to create solutions that improve Black maternal, paternal, and infant health in Kansas through training, research, healthcare, and advocacy. And we do that in many ways with having a vision of our making sure that our Black parents and infants receive intentional and quality care, and then also celebrating babies that live past that 365-day mark. So you have been taking the birth equity training, and the purpose of this training is really to provide you an overview of Black maternal health, the need for birth equity, which you guys are truly focused on in this work, and to gain an understanding of various factors contributing to this maternal and infant health and the mechanisms that aid in obtaining equity. So how do we begin in the state of Kansas to really create equity? And how do we come to understand the stories, the public health experts that are Black and doing this work, those that are minorities, as well as community advocates, and then also understanding the current health data, not just in our state, but nationally, what's happening around birth equity and why now is the best time for us to begin to really address birth equity and create that in our state. So you have several modules that you've been completing: the introduction, the need for birth equity, community engagement, the uncomfortable truth of bias, the Black postpartum experience, and respectful maternal care, which is really an action on how do we begin as a state to create respectful maternal care in all of our communities and all of our clinical settings, because it's going to begin with all of us. And so now you're going to have check-ins with some of those that have completed our birth equity curriculum, as well as like how they have done that. But before we do that, we're going to ask you which modules you've completed. So you can respond to this poll by saying which modules you've completed to this point. So where are you in completing your modules? And this is just a check-in. There are no wrong or rights or no inappropriate. If you're at module 1, we want to know that because we want to help you get to the last module. If you're at module 2, we want to know that because the goal is to help you get to the last modules. And we're here to support you. Tara's here to support you. So don't feel uncomfortable about answering this question. I will tell you that a lot of you have reached the milestones of completing the curriculum, and we're going to celebrate that at the end of my presentation. So please take some time to check in and tell us where you are right now. You can respond to the poll by using pollev.com/OOBI. So on this, you can use that on your cell phones or on your computers, and we will get a chance to see your results. So I'll just give you a few minutes to do that. Give me a thumbs up when you're done. Okay, see your thumb, Tara. Aloma, do you want to share the results?
Yes, I can. I think I do need you to stop sharing for a
Okay,
second.
sure, absolutely. So this is absolutely amazing, and I'm sure that Tara is very proud right now that we have a large number of individuals have completed the curriculum evaluation, which means they are done with the curriculum. And we still have some that have just completed module 1. And so again, I want to remind you that we're here to help you. And then we have some that are at module 6. And look, some that are at module 5. So that is really amazing to be there just to see these results. And it's changing.
And Dr. Smith, we have a question in the chat. Can you see?
Yes, I see that from Lucia. Thank you. That actually I have to pass that question to Tara because she gets to decide who is next in taking the curriculum. So Tara, do you want to address that question? You're on mute.
Oh, this is just one of those days. I'm feeding my face and I got caught. The answer is we don't have a perfect answer because I want Dr. Smith, you and I need to talk about how that's going to roll next. The intention is to educate the champions and they will educate their staff, so train the trainer, and then to go out across the state. But Dr. Smith, we don't want to overwhelm your staff either. So I'm ready to go. Like I'm ready to do this statewide as soon as you guys are, because as we're seeing, everybody wants in.
Okay, so I guess the answer to your question, Lucia, is that Tara and I are going to have a conversation and make sure that while everyone is still interested, that there is an opportunity for everyone to participate. So we are working on that. Thank you for bringing that question up and continue to put that in front of us so that we can make sure that we're moving fast to make sure that everyone gets access. Aloma, do you want to share the slides so that you can share the pose?
Yes, absolutely. Just a second.
So congratulations to those who have completed the curriculum and congratulations to those who have completed components and modules of the curriculum. So just keep going and thank you so much. Next slide, please. All right, so let's talk a little bit about the module that focuses on the uncomfortable truth of bias. And this has to be one of my favorite modules in the curriculum. Of course, all of them are my favorite, but so that's why I say one, because this one really talks about how we look at bias and then what are some of the voices around that. So this actually has some stories and discussions from Black parents, Black fathers and mothers and birthing persons about their experiences and how they have experienced biases, how they've overcome them, and then what they truly think we can do to really address some of these issues. And these are our own parents in the state of Kansas, like they live in Kansas, they had their babies in Kansas, right? They're parenting in Kansas. And so it's important that within our own state, we understand what Black mothers and fathers are experiencing and where they're experiencing those issues, right? Because they're not always with healthcare. A lot of them are with healthcare, but they're not always healthcare. And so we want to make sure that we understand how they view things so that we can address biases in their views that may not be things that as clinicians or researchers that we're truly aware of or thinking about when we're providing care or asking them to participate in these projects. And so I really want to know from you, when you listen to these panel, or this particular panel, where Black mothers, birthing persons, and fathers were talking about their experiences within the panel, what was your first reaction? So what was kind of your aha moment? What stood out to you in that conversation as you listened to? And if you haven't listened to this, you know, maybe you've heard some conversations and you just want to talk about like what stood out to you in some conversations around these topics. whether among Blacks or other Black mothers or fathers. So I want to hear from you, what stood out to you in this module? And of course, this is module 4, and there is a large number of individuals that have completed module 4. So they're far along in their modules. And so we want to really hear from you as what stood out to you in these conversations in this panel. So while you're completing that, I'll tell you that one of the things that stood out to me in that panel was when one of the parents mentioned that we needed advocates at every level in order to really achieve birth equity. And so I thought that was really interesting and also relevant to this group, this work group, because this is creating advocates at every level to do the work. And so the work that Tara's doing in this 4th trimester initiative is creating additional advocates so that we can create birth equity in our state. And so that was one of the things that stood out to me. And I hope that there were a number of things that stood out to you and you are typing them now in your responses.
Hey, Charla, this is Jessica from HaysMed, and I'll just kind of speak to, I was just really amazed, I guess, being from a hospital that doesn't have a lot of variation in our patient, with our patients, and just feeling like really disappointed in healthcare providers and in the systems that we're not able to be fair to everyone. And I don't know if that's just because of my inexperiences. And so I haven't seen a lot of things like that, but it just made me a little bit dumbfounded in thinking through some of the stories that the moms had said that they had experienced, and just that we got to do better.
No, thank you for sharing that, Jessica. And anyone else who wants to share, please chime in. But I think that's absolutely right, Jessica. Sometimes we don't know what's happening, right? Because your role every day is to provide quality care to each person that walks in. And so sometimes we don't know things that are happening at other clinics or within our own clinic that someone may have encountered. And so hearing that from the voices of parents gives us that eye opener of like what is going on and how do we do better. And maybe it's not our clinic, but then every clinic needs to be, you know, intentional in their care. And so that was really great insight. Anyone else wants to share what kind of stood out to them in that conversation?
This is Carrie Smith from Advent Health Shawnee Mission. I feel like there's an element of it where I think we tend to sometimes listen to patient stories and think, oh, that was just their perception. They must have misheard what the nurses were educating, or they must have misheard what their physician meant or didn't understand. And then you realize, no, this is not just a one-off. This is an entire community. And you acknowledge that you need to take back the ownership and think it's not a perception issue, it's a care issue. Or there's an element of we think we know best. And so instead of truly acknowledging that the patient knows their body or their situation or their experience, just being open to that and not assuming that we know best for them.
No, thank you so much, Carrie, for sharing that. That's absolutely correct. I think that we do, and I attended the ACOG conference this year, and one of the things that was mentioned was that in our clinical guidelines and you know, best practices and procedures, they don't tell us, you know, your patient knows your body, right? And so the reality is that a lot of the training doesn't encompass some of those things that have to be individually done with treating individuals. And so that is just one of those things when we listen to mothers and fathers talk about this, we can see it from a different perspective, because the goal is to make sure that everybody survives, everybody's healthy. And sometimes we're not thinking about what they know, we're thinking about what are the recommendations what is usual care for this particular diagnosis, rather than that person knowing their body. So that's very insightful, and great revelation, Carrie, for this listening to lived experiences and not just thinking that is an individual, because often it's not. There are a lot of shared experiences and stories that are exactly the same, from mother to mother or father to father. So it's important that we begin to address that. Does anyone else want to share before we move forward? All right. Lost our slides. So, of course, someone did mention the advocates, when people do not have voices. I think the reality is, like, how do we begin to create the space where they have voices and also there are advocates? So that would be a great accomplishment. But in module 5, it really talks about the Black postpartum experience. And in this module, it was very important that we begin to highlight those birth workers that were doing this work, not just in our state, but just around these different experiences. But most of them are in our state, or have done some work in our state. But in this module, you really heard from experts on maternal mental health, experts to support Black breastfeeding in Wyandotte County, and from a doula on her experience and effort to provide postpartum support. You also heard about Black breastfeeding and safe sleep from an advocate that has worked closely with our work here in Kansas and helped a lot with our community engagement. And so it's just important that we highlight that these individuals are doing this work, and that the best approach is to understand what they're doing and their goals, and then begin to build those collaborations across the state, with organizations that are focused on our Black families, as well as making sure that we highlight those services and all of the things that we provide. And so when you listen to this, you heard a lot of the experts talk about what happens around maternal mental health and how those things are either underdiagnosed or are not diagnosed, and as well as what it means to be a doula and what doulas do, what they provide, how they could collaborate with clinicians. And I know there's a lot of work, a lot of conversations in our state about how do we begin to bridge that gap, between doulas and providers, making sure that patients have everything they need at every level. And then efforts about breastfeeding. So how do we begin to continue, or how do we continue as a state? Because I think we've done very well as a state around Black breastfeeding, but how will we continue to embrace and empower mothers to continue to breastfeed and increase the duration of their breastfeeding, as well as promoting safe sleep, which is there's a lot of work in our state around safe sleep as well. But how do we all take on that? And so that module is very important in creating birth equity, because it gives us an overview of all of these experts and the work that they're doing. So I have a question for each one of you, and feel free to share your response if you do not want to type it. And what can you or your organization do to improve postpartum support for families you take care of? Now, I know this is an important question, one, because Kansas has a major win, right, from the governor in extending postpartum care to a year. So I know that all of you have been thinking about this, of course, already, but I want to hear how we can work together to do that. Now that we do have the opportunity to support mothers for that first year, which is a major win for our state. And I'm sure that all of you guys were involved, and KDHE was heavily involved in that, but that's a major win. So what do we begin to do now to support them or to take care of them? So I see the responses coming. Advocate for training using expertise from the community we serve, and advocate for culturally congruent care. Absolutely. Listen to patients and families and follows through. Absolutely. FMLA legislation and pregnant worker fairness. Absolutely, but definitely more work to be done around there. So does anyone want to share what you or your organization do to improve postpartum support for the families you take care of? So I can't really call on anyone. I know that follow-up care and resources after discharge, which is really important. Advocate for paid family leave, very important. And educate all healthcare workers. So these are very important things that your organizations are already do and working to do to improve postpartum support for the families that you serve. And so it's very important that we continue to do these things and all of us work together collaboratively to make sure that this happens. Okay, so someone put in the chat that they're currently revamping their PP program, which is really great. So there are a lot of things happening in our state around postpartum care.
Dr. Smith, can I jump in?
Yes, please do.
One of the things that I'm hearing across the state, and I'd be interested to hear from some of the folks on the call, is the staff shortage. We'll call it staffing shortage at all agencies and all community health worker. Like, there's a lot of, we need more people, right? And look, people are still jumping in. I'm hearing us talk about advocacy. And don't you think part of the issue is that we need to help people enter this? Let me ask a different question. I think we need to advocate for more Black nurses and more Black community health workers and more women and men. I'm not hearing that conversation at the state level, but I'm hearing it at the local level. Like, we're trying to be more aware and we're trying to make sure that everybody is represented when we're talking about medical care, social determinants of health care, et cetera. What's your thought on that in terms of how to tackle the issue postpartum?
So that question is for me, right? Well, I will tell you that KU is actually having the conversation and working diligently to increase the number of Black providers in OBGYN and family medicine that do perinatal care. And so one of the things that they've done was really increase the ability to help them pay for medical school and to give them the opportunity to get a birth equity scholars training fellowship certificate. So we have a birth equity scholars training fellowship program that is now 2 years, where residents will get an opportunity to really learn about birth equity, to volunteer within the communities they serve, right? And they'll get an opportunity to work in policy as well. And so that is the opportunity to increase their awareness of what can be done in the state of Kansas and hopefully retain them, because we have a lot of Black residents, we just do not have Black attendees. And so the reality is to really give them an opportunity to get some additional training and experiences so that we can retain them. And then there is a birth equity scholarship as well to bring in medical students to give them some experience with KU and what is done in our state. And so I think that that is one of the things that we're doing, but it is necessary to increase representation for postpartum care. But now, of course, with the shortages, it's just necessary likely to maybe coordinate care between the doulas to provide postpartum support for patients, as well as having that provider do some work. And of course, we've hired midwives. So, hiring of midwives and that additional support in the postpartum stage is going to be important, because we're already short for overall prenatal care. So making sure that we have the capacity for those to return for their postpartum visits, as well as getting, quality care when they return. So I think that is some of the things that we're doing at KU, but it's definitely necessary to bridge that gap between those that are non-clinical providers, birth workers, as well as clinical birth workers, so that it doesn't always have to be the provider that sees something or deals with something. If they have that additional advocate and birth worker who is representing them and has a great relationship with their clinician, they can also follow up on what is concerning or any issues that that patient has. And so it's going to be important. And I know Mariah has the maternal community health workers, right, program. And so that's funded by KDHE. That's also a program that a lot of clinics should build relationships with those maternal health, community health workers, so that they can get those in the community to really also provide any services that, patients may need in that postpartum period. And Elizabeth has shared something as well. So that would be my response to that, Tara. So I hope that answered your question. But if you all are interested in like our scholars programs, I'd be happy to talk with you guys about what's happening around our scholars program and our scholarship program and what we're doing to retain, because we don't have a problem with recruiting, you know, Black physicians as residents, but we are not able to retain them for after they complete their residency. And so we want them to stay in our great state and do the work that's needed. And we see a true embracement of them in our clinics. Like patients are very excited when they walk in and see that they are going to have, you know, that there's representation, right? And they often ask for them because they want to make sure that there's representation and they feel safer. And so that's one of the things that our chair has seen, and she's really embracing and making sure that we're able to retain them. All right, so respectful maternal care. In this module, you're going to learn how to provide respectful maternal care. This module has to be one of my favorite modules. You'll hear me say that often. But the reality of this module is that it was actually birthed out of a conversation with our parents. When we were talking to our parents, and we have an advisory board, and they talked about how we needed something in this curriculum that basically told providers, social services workers, so those in the community as well, how to be intentional about, you know, Black women and Black families. So this was a recommendation strictly from our patients, which makes this very important in our curriculum. And so they wanted to do a simple campaign. And so they came up with this campaign, Stop, Look, Listen, and Think campaign, and how that would really inform, you know, really inform our providers at every level, and service providers as well, of how to treat them, right? And so this one really looked at, you know, stopping and stop focusing on routine care. If a birth person says that they do not feel well, believe them, that they feel something wrong. You know, just basically looking at them as you're having a conversation with them, intentionally listening to them and thinking. So the reality is that you would provide that intentional service. What would you want to be the response to yourself if you were providing this information to your provider? So really the opportunity to stop, look, listen, and think. And we know that often you don't have time to do that, but if we just take a few minutes and think about what the person is presenting to us, and then even if we know this information could not be true about a patient, addressing it in a way that lets them know that we are receptive to their concerns, and that if something does arise, it's comfortable for them to bring that to us. So this was really a great module, and it also includes having crucial conversations. So one thing that we wanted to do in a discussion with our parents is we didn't want to just have something that was just a campaign for providers on every level. We wanted to have something that also supported parents. How do you have crucial conversations with your providers? And what does a crucial conversation look like? And how should it be done? And also that is a great resource as well for providers, because now you understand that those parents are really trying hard to have these crucial conversations with you. And so this campaign is something that you can post at your clinics, but it's also something you can post, like I just have it posted in my office here, but it also allows you to address people in an intentional way. And so this is providing respectful maternal care, and it's a Stop, Look, Listen, and Think campaign. And so I really want to ask you, in looking at this, in what ways can we encourage your organizations to stop, look, and think to ensure respectful maternal care? And you can feel free to share this by unmuting yourself and saying that, but I want to know, how can we encourage your organizations to stop, look, listen, and think to ensure respectful maternal care? What does that look like to you? So while you're posting your answers, I'm just going to direct a question to Tara because she's the only one I can call on. But Tara, when you think about this Stop, Look, Listen, and Think campaign, what are your initial thoughts and how this aligns with the 4th trimester work?
Well, actually, Dr. Smith, I was just thinking how quickly we could print those off in 11 by 14 and send them across the state. That's what I was thinking. So quick word phrases as you walk into a room or as you walk into the bedside or as you visit someone in their home, whoever is represented in this group that's listening. What you just taught me was the quick 4 things I need to do before I walk in. So actually, I would say it's the prep. It's the prep before the interaction that needs to be relearned, right? Versus just seeing as many patients as we can in the day. If you're a provider, if it's a nurse, just getting her delivered or getting her to postpartum or checking her fundus. But quite frankly, what you all, and from me reassessing my own practice, part of the story is stop what you've always done. Stop. It didn't work. So from postpartum care all the way through specific birth equity work, what you're saying, Dr. Smith, is that really this is an important 4-step process for all of postpartum care, right? The bedside moment, those 4 things, but look at postpartum care by stopping, looking, listening, and thinking about next. But I love that. I love the 4-step process.
Well, thank you. And yes, this is, someone asked a question. This is available to every organization. We're happy to print them or with FedEx or Tara, work with you to get them printed and sent to each of the clinics, and we'd love for you to hang them. I think it also is, yes, someone posted educating patients on what to expect. I'm glad you posted that because we're going to be working with CHC and Mariah's group, and we're going to be developing a book on what parents should expect in the prenatal experience. And I think, and it's just gonna, of course, it can be for any parent, but we're gonna really collect voices around minorities and what they're experiencing and what to expect, because I do think that there is a gap in what patients expect and what's provided and who they can actually ask questions to, right? And so the idea of creating something for our state of what to expect and getting the voices of patients and providers. So there is a survey that's been done, and we're expanding that for providers and patients, and then to really talk about what to expect when you're expecting. And so that is one of the projects that we're doing, and hopefully we can gather more collaborators and partners on doing that, but that will be a Kansas Birth Equity Network project. Thank you. Yes, share with staff at the front desk. I think staff at the front desk could also, you know, use this as a resource to stop, look, listen, and think, because that is the first encounter. And you would be amazed at how many, not, of course, not in this work, but when I did work in Arkansas, how many individuals talked about their experience with front desk individuals and how that determined whether or not they felt like they received quality health care, right? Because that's their first encounter. So definitely that. Encourage staff to stop multitasking and listen and then think before responding. Great responses. So these are amazing. It seems like you guys are already doing some stop, look, listen, and think activities. Encourage staff to be at the client's level, literally, and make eye contact. Amazing. I love when people make eye contact with me. And so I think that would be great. And so, yeah, looking around. So these are some great responses, and I'm glad. And please, we can, of course, save the chat, but we do provide this data to the 4th trimester initiative. So we'll try to make sure that these are included in our polls. So these responses are not collected for us. We collect them for you guys. So a year from now, when I come back, we can talk about what you said while taking this training and what you've been doing after completing this training. So we will save these and bring them back to you. And hopefully we can put names to them. So therefore we can say, what are you doing? So this is a great activity. Listening to stories. So I like looking around and seeing how they're coping, listening to stories, and give referrals where needed. Amazing. All right. Next slide, please. Thank you guys so much for that great discussion. All right, so now we're going to have a true discussion And that discussion is going to be done by our own Carrie Smith, who was one of the first individuals to complete the curriculum. Is that right, Carrie? So she should be given a major, major applause because I believe she was the very first one to complete the curriculum. And she's a clinical nurse educator at Advent Health in Shawnee Mission. And she is going to respond to these two questions. What are some of your aha moments while completing the birth equity curriculum? And what next steps are you thinking about for you and your clinic, and for your clinic? And then anyone else who wants to jump in, who's completed the curriculum, feel free to respond after Carrie. All right, Carrie.
Well, thank you. I actually think I was the second person, so I don't want to take full credit for being the
Okay.
first.
It's
but,
a technicality, Carrie. You were one of the first.
One of the first.
So tell me, what are some of your aha moments while completing the birth equity curriculum?
I think we hear statistics all the time in where our shortcomings are in healthcare. And like I mentioned earlier about Module 4, it really hits home when you hear it firsthand experience from people themselves rather than just reading the data or reading the literature. So that meant a lot to sit there and watch the videos of the couples sharing their experiences. It was sad too, like I think Jessica said earlier, it just kind of makes you sad to think that we're failing so many people at the same time. I am excited to roll this out. And when someone asked that question earlier, I was anxious to hear what your and Tara's answer were as to how quickly we can get this out to our staff, because I think it's important, obviously not just for us as the champions to complete it, but just for all of the staff to realize we have big steps to take and a long way to go in closing the gaps and making healthcare safer for women when it comes to delivering. So I thought that hands down was my favorite module, and then just acknowledging that that we do need more resources. When we had Tara and several of the community members at our facility last week, I felt so unaware of all the different resources that were available. So to have completed the module and then to see all of the resources available and to know that it may not feel as hopeless to get access to those as I thought it would, really made a huge difference.
Great, great, great. All right, so tell us, what's your next step? What next steps are you thinking about for you and for your clinic after completing the curriculum?
We, I think, should get this to our physicians as well, not just to our nursing staff on the inpatient, because I work on the inpatient labor and delivery setting, but then to continue partnering with the resources that were shared with us at our recent meeting to make sure that it's disseminated. I think everyone who is going to impact patients is knowledgeable in where we could improve and what the needs are. So I do feel like this is a great resource that anyone who's going to have an impact on patient outcome should have access to. And I know Trisha Roush, who is from my facility too, just made a comment in the box wanting more information to share with postpartum patients for her postpartum emotional support group, because she has amazing support groups and access to those patients firsthand that she could impact them by.
Great, thank you so much for sharing that. Now we have others that have completed the curriculum. So I want to ask, I'm gonna see if you guys are on. If you're on, then I'll be able to ask you a question. Just what were your aha moments? So Chelsea, I think that's how you say your name, or Chelsea James. Can you tell me what your aha moment was in completing the curriculum?
Oh, can you hear me?
Yes.
Sorry, I was not prepared to unmute myself today. I think really just hearing those personal stories really just hit home with me for that.
All right, great. Thank you for sharing. Jessica, can you tell me what your aha moment was?
This is Jessica Sibe. Can you hear
Yes,
me?
Jessica
Okay.
Side.
I think thinking back to it, it was really interesting hearing the fathers talk. And when they were talking about how they feared for their wives or their partners when they went in to have babies because of the history of people either not listening to them or family, implications of other family members when they've had their babies and not had good outcomes. That was really striking to me, to think of it from their side of the ship, of the street, however you want to say that. Because they're sitting next to the bed and the mom's in the bed, but they're could be very afraid for her life in some of these situations. And so that was really impactful.
Great, thank you for that. Thank you guys so much for sharing your aha moments. Does anyone else want to share their aha moments before we celebrate those that have completed it? All right. Well, congratulations to those who have completed the curriculum. This list has definitely grown since the last time I was with you guys. So congratulations to all, and a big round of applause. If we could all just choose that applause in your reactions for them. Just a big round of applause for each one of you who have completed this, and thank you for diligently working to complete it before this meeting. And we have some that are in progress as well, so I want to give them a hand of applause because they're working hard to complete it as well. So we're just excited about those who have had the opportunity to complete it and are also working to complete it. But I want to stop there and ask, are there any, or what are the challenges with completing this curriculum, and how can we better help you? And you can put that in the chat, but we want to be able to help you to finalize this curriculum, like complete it all the way and do the evaluation. So please put those in the chat, just letting us know what we can do to better support you. And we will do that to make sure that you're able to complete that. But again, a major round of applause for each one of you who have completed the curriculum and are in progress of completing it. And we do send out certificates of completion, so you will be getting those in the mail. Do we send those to you, Tara, or directly to them?
Either way is fine, whatever's easier for you guys. And we may want to combo some ideas if we're going to send out the I think you've got a big request for those wall posters.
Yes. So we will work with Tara to make sure that you get your certificates of completion. So thank you so much. All right, next slide. So now I am excited to tell you what the actually action items are. Is that you have the deadline of August 31st to complete all 6 modules and the curriculum evaluation. And so that was the deadline set for that. So please continue to do so and complete that. And then, as well as if you have questions, concerns, comments, there's some barrier that you cannot get through a module or something happens, please reach out to us at our email, which is kbn@kumc.edu, or call or text us at this number. You can text us any time of the day. It will come directly to our email. And so we're grateful that you have begun to do the curriculum, but we're also here and ready to help you to move forward in the curriculum. Next slide. All right, so I am excited to announce to you that we are going to have our first inaugural Birth Equity Summit in collaboration with the Heartland Conference on Health Equity and Patient-Centered Care, which is actually a conference that is sponsored by KDHE, but we will have our first Birth Equity Summit September the 9th from 9 to 12:30, and you can attend this summit in person and online. So if you're in this meeting and want to attend, please go ahead and register for the summit. We would need to have you registered to send you the link to view it online if you cannot come to Overland Park on September the 9th. And so we're so excited about our special guests. And so if you've not read Dr. Davis's book about injustices in birthing, you want to read that book. And she is going to be in person signing autographed books that day. So if you are able to come to this summit in person, you will leave with an autographed book. So that's a great incentive for coming. She's going to be having a conversation around birthing and experiences within the healthcare. Of course, she has a couple of books as well as publications on this work and really talking about preterm birth and what happens in the birthing experiences. So you don't want to miss that. And we're also going to have Kevin Detner there. Kevin Detner is a dear friend of mine who's done a lot of work around Black mental health and overall mental health and has a book as well. He is also going to be signing autographed copies of that book as well during that summit. And so you don't want to miss that. We are really looking to talk about severe maternal morbidity and chronic hypertension. So we'll also have Mother Hakima from, of course, Uzazi Village, who will serve on one of our panels to talk about that and the data around that in our state, as well as in Missouri. And we'll have our parent panels. So you guys have listened to a couple of our parent panels in your curriculum, but we are going to have these parents during the summit discuss their birthing experiences around severe maternal morbidity and chronic hypertension, as well as how they're coping with COVID. So 2 years after, how are they coping with COVID and the disparities? And so this is a very, very exciting opportunity. And then following that parent panel, we're going to have a healing session. And we have someone coming from New Orleans, Dr. Tori Harris, who's done a lot of health equity work in New Orleans. We know that New Orleans adopted racism as a public health crisis. And so just talking about her health equity work in New Orleans and how as a community, we can begin to heal after hearing all of these things about our birthing experiences and move in the right direction. So this is going to be our first Birth Equity Summit. And of course, we plan to have these annually, but you don't want to miss this because this is the only component of the conference that's both in person and online, and the only component of the conference that focuses directly on birth equity, and the only component where you can get your autographed book from these authors. So if you have not registered, please register. And if you're able to join us in person, we will be having a birth justice walk run that morning. And so we will walk in solidarity that we as a state support birth justice. And so that will be a great opportunity to join us as a state. So please do so. All right, that was a lot to say, but I'm so glad that I got to tell you guys that we're finally having a Birth Equity Summit here. And again, we will be celebrating Black babies living past the 365-day mark. And we do have a Black baby photo contest, and that winner will be announced after the conference. We have 25 entries. So this is not only an opportunity to talk about birth equity in our communities, but also to celebrate the fact that as a community, we are improving, which means we're celebrating more and more Black babies living past that first birthday. Any questions about this summit? Okay, so we're over time, so I'm going to move forward so that Tara does not end my slideshow. Thank you guys so much for the opportunity to come and talk with you about the birth equity curriculum. Thank you for completing the birth equity curriculum and working to complete it. And thank you for registering for the summit.
I wasn't going to cut you off. Don't worry. You guys, really, that's a wrap. I think, as usual, when we have challenging and yet good conversation, you're left wanting more conversation. And I think the biggest take home is we got to get this out to the state pretty quick. All of our hospitals need it faster, Dr. Smith. This is a good problem for you and I. So with that, you will get a resource follow-up. We will email out everything from the websites to the birth equity flyer, any of the things that you all saw today. So you'll see that in a follow-up email in the next couple of days. Dr. Smith, you guys, thank you so much for joining us. To everybody else, keep doing good work, but ask lots of questions of yourself for sure. Have a great day.
Tara, I can send the birth equity flyer to you guys for that so you can send it out to everyone.
That would be great. I think Tiffany would appreciate. There's two, I think, that we need to send out. Isn't there, Tiffany? 2 flyers that we need to
Yes.
send out.
Yes,
And if
if
we
you
need to
would
do
have
it,
sent that to me, perfect, I can add that.
Yeah,
to
because
follow-up.
it's just, yep, thank you, Dr. Smith, because it's just in the PowerPoint that we have right now. It'd be easier if we could get it in a PDF or whatever attachment idea.
Okay. All right, great. I'll
Okay,
send
great.
that. Thank you guys so much. This was amazing. Always
you.
amazing working with you, Tara.
Well,
Always.
and you too. And I think, I know we're going to hook up with implicit bias conversation, but I think you and I need to hook up about next steps. I feel it imminent.
Yes, yes,
Okay.
yes.
Okay.
I do think so, because one of the things I want to do is next year when we do this summit, I want it to be a collaboration. I want it to be something that comes from all of us.
Great.
So of course, this year we were kind of working off of getting it done, but next year I want it to come from all of us. So
I love it. I love it. I also, you're going to get busier real fast, and I don't want to overwhelm you. So it's okay to pump the brakes with me if you need to, but I think we should take advantage of the excitement. Is that that's an appropriate word to use in this setting? It doesn't feel like I should use that word, but anyway, yeah, let's you and I connect soon. I'll just send you some dates the next couple of weeks. And I think let's huddle as we're finishing the training and moving forward.
okay, sounds
All right.
great. Thank you
Thanks
so
so
much.
much.
Have a good one.
You too. Thanks.
Bye, guys.
Bye.